Hi, I'm Raymar B. Calyado from Section Weidenbach. For this video, I will perform nasal instillation. But first, what is nasal instillation? Nasal instillation are used to treat allergies, sinuses infection, and nasal congestion. The nose is normally not a sterile cavity, but because of its connection with the sinuses, medical asepsis should be observed carefully when using nasal instillation. For the assessment, assess the nares for redness, erythema, edema, drainage, or tenderness. Assess the patient for allergies. Verify patient name, dose, route, and time of administration. Assess the patient's knowledge of medication and procedure. Assess the patient's ability to cooperate with the procedure. For the objective, first, to instill directly the medication into the nostril or nares, to provide means for nasal evaluation, to obtain desired therapeutic effect. For the equipment used for this procedure are medication, dropper is not part of the medication container, gloves, optional, tissue, and medication card. Step 1. Gather equipment. Check medication order against the original physician orders according to agency policy. Clarify any inconsistencies. Check the patient's chart for allergies. This comparison helps to identify error that may have occurred when orders were transcribed. Step 2. Know the action, special nursing consideration, and safe dose ranges, purpose of administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder, and can also be used to educate the patient about the medication. Step 3. Perform hand hygiene to prevent the spread of microorganisms. Step 4. Place medication on tray or move the medication cart outside of the patient's room or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Step 5. Transport medications to the patient's bedside carefully and keep the medication in sight at all times. Careful handling and close observation prevent accidental or deliberate disarrangement of medication. Step 6. Identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. Identifying the patient ensures the right patient receives the medication and helps prevent errors. Step 7. Explain procedure to the patient to gain cooperation and to allay anxiety. Step 8. Offer tissue to patient and ask patient to blow his or her nose. Blowing the nose clears the nasal mucosa prior to the medication administration. Step 9. Have patient set up with head tilted well back. If patient is lying down, tilt head back over a pillow. These positions allow the solution to flow well back into the nares. Do not tilt head if the patient has a cervical spine injury. Step 10. Draw sufficient solution into dropper for both nares. Do not return excess solution to a stock bottle. Returning solution to a stock bottle increases the risk for contamination of the stock bottle. Step 11. Ask the patient to breathe through the mouth, hold tip of nose up, and place dropper just above nares, about 1/3 of an inch. Instill number of drops in one nares and then into the other. Protect dropper with a piece of soft tubing if patient is an infant or young child. Avoid touching nostril with dropper. Breathing through the mouth helps prevent aspiration of solution. The soft tubing will protect the patient's nares from injury during administration of medication. Touching the nares may cause the patient to sneeze and will contaminate the dropper. Step 12. Have patient remain in position with head tilted back for a few minutes. Tilting the head back prevents the escape of the medication. Step 13. Perform hand hygiene. Hand hygiene deters the spread of microorganisms. Step 14. Assess the patient to a comfortable position. This ensures patient comfort. Step 15. Evaluate patient's response to the procedure and medication. The patient needs to evaluated for any adverse effect from the medication or procedure. For the evaluation, patient cooperates with nasal instillation of medication. The therapeutic effect is obtained. Experience no adverse effects, including allergy response, systemic effect, or injury.